When we have a nerve that's a little bit stuck or we want to mobilize it a little bit, we can use nerve glides. And so there's 3 nerve glides that we'll talk about. Main thing with these is that we're trying to minorly elicit symptoms, but not cause them to get worse. This is one of those things where you can do too much of it, and it is most definitely not a good thing. If you piss a nerve off, it'll stay angry, it'll stay irritated for 3 to 5 days, sometimes even longer, and there's not much you can do to help get it to calm down besides take medication. So the 3 nerve glides we're going to talk about are a radial nerve glide, a median nerve glide, and an ulnar nerve glide. Okay? So radial nerve glide, what we're going to do is extend the shoulder, straighten the elbow, flex the hand so that our palm is pointing up to the ceiling, and right there, if we turn a little bit more, we get a little bit of a stretch in through this portion of our hand towards our thumb. That's going to be our radial nerve tension. What we're going to do when we glide it is go off tension at that spot too. So we're bending the elbow and bending the wrist, extending the wrist and extending the elbow. And we're just going to go back and forth there. For a median nerve glide, this is one you would use if you had carpal tunnel, is to come out to the side and back with our fingers back. So from here, what we're going to do, I usually have people start at the shoulder, hand to the shoulder. We're going to extend the elbow so that it's straight with the wrist still flexed. We're going to bring our hand back behind us, and we're going to then extend the wrist and fingers all the way. That's maximal tension. So when we're doing the nerve glide here, we're going to back off by bending the elbow and keeping the wrist extended, and then do the opposite. Keep the elbow extended and flex the wrist and hand. And we're just going to go back and forth like this. Ulnar nerve is if you have something at the elbow through your cubital ulnar tunnel or through Guyon's canal, you can get numbness and tingling in these 2 fingers, some weakness in your thumb. What we want to do here is come up to the side all the way, bend our elbow, point our hand away from us, and then pull our fingers down. So the end position should look like you're almost like putting funny goggles on. What we're going to do here after we get to full tension, or in place of full tension, is we're going to create some slack on the system by bending the wrist with the elbow bent, and then straighten the elbow and extend the wrist. And we're going to come back and forth in these positions. Remember again, all of these are just minimally provocative. They should not cause symptoms to flare or last or linger.